Dental restoration refers to the various procedures and techniques used to repair or replace damaged or missing teeth. They are necessary for a variety of reasons: tooth decay, trauma from accidents like sports and traffic, or even natural wear and tear can cause damage to teeth, leading to pain, infection, or difficulty in chewing.
The absence of a tooth tends to alter the function of the teeth. Because when you look at the standard tooth model, there's a way the teeth have been designed in such a way that the upper tooth and the lower teeth have a relationship. Now, absence of one tooth alters the relationship entirely on that side of the jaw. For example, if this lower tooth is removed, now the upper tooth has nothing on which to bite. Now, unfortunately, because of that, it begins dropping. Okay? It begins dropping because it's looking for something on which to bite. So in the process, you find that you're losing also an opposing tooth because I removed one in the lower tooth. And the other teeth on either side of the gap also tend to move. So in the process, you find that because the function of the teeth ideally is two. One is to chew, to eat food. Now, absence of a tooth on one side, definitely you're not going to be able to chew the food from that side. You have to be forced to use the other side. Two, the teeth hold the cheeks in position. When you remove a tooth or two teeth, you find that the cheeks tend to drop in. So someone who's ideally 20 years is looking like a 40-year-old or 50-year-old lady or gentleman.
Dental restorations can be made from a variety of materials, including amalgam, composite resin, porcelain, and metal alloys.
So the filling can either be a composite filling or an amalgam filling, basically depending also on the position of the cavity in the mouth. Normally the front teeth, since it's an aesthetic zone, we like to use the tooth-colored restorations. But at the moment, there are some tooth-colored restorations which are also being used for the posterior teeth. So those are fillings, basically. Two, if a tooth has been broken, let's say it has a fracture, and it's a front tooth, you can either use a composite filling or you can use a crown. Now, the crown is dependent also on the extent of the fracture. For example, if you believe that half or 2/3 of the tooth is a filling, the tooth is weak, so you need to put what we call a crown.
The process begins with a comprehensive examination and assessment of the patient's oral health. Depending on the specific needs of the patient, the doctor may recommend different types of restorative treatments.
And the crowns come in different types. It can be either a full metal crown or a zirconium crown. Currently, we are using the zirconium crowns because they are more of tooth colored. They maintain the aesthetics of the restoration of the tooth. Secondly, the restoration can also be by doing what we call a root canal. For example, if the patient comes in and the tooth is broken, or it has a cavity, and the cavity is extending all the way up to the nerve of the tooth. Normally here we have to remove that infected nerve, fill it with a polymer filling called a gutta percha, and then we build up the tooth. Then after building up the tooth, because it was that badly damaged, to maintain function, okay, we always recommend that you put also a crown.
The lifespan of a dental restoration can vary depending on several factors, including the type of restoration, the material used, and the patient's oral hygiene habits. Walter Mwesigye, NTV.